Hello and welcome to this special edition COVID-19 Rogers TV program. My name is Carol Merton and I want to thank you for joining us. At the beginning of each program, I like to, before I welcome guests, to say thank you. And I wanted to actually read from the thank you information that I have today because it's a little different than I have been saying in the past for those who watch the program on a regular basis. So bear with me while I read this. So first of all, this information was sent to me from Francesca Dobbin, who is the Executive Director, United Way of Bruce and Gray. And I'm going to read excerpts from a letter that was sent from a writer by the name of Allison Wines. There is an invisible group of people who aren't being recognized, who are working intensely to keep the world turning, to make sure that those on the front lines have the support they need, and those at home have something to go back to when we get to the other side of this. Who are you? You're the HR teams working 80 hours per week to start workforce planning from scratch, redeploying team members, trying to think of something, anything, to preserve jobs. You're the CEOs of charities, writing new budgets so you can keep helping the world with funding that has evaporated overnight. You're accountants and bankers, restructuring finances and debt to help small businesses stay open. You're trade managers negotiating frantically to get hand sanitizer and face masks into the country. You're consultants supporting clients through massive change, unsure if you'll get paid for your work when it's all over, but doing it anyway because it matters. You're hospital administrators running payroll for the nurse that just clocked 30 hours overtime. You're communicators trying to find the words to explain a crisis the like of which has never been seen to your organization's staff and your community. To you, I say you are not invisible. Our message back to you is your contributions are greatly appreciated. We send to you a most heartfelt and sincere thank you for what you are doing. And I want to express a sincere thank you to my two guests today. And I'd like to introduce them now. So I have Jennifer Cornell, who is the Director of Long-Term Care for Gray County. And with Jennifer, I have Stephen Musehl, who is the Executive Director of Alzheimer's Society Grey Bruce. So thank you both for joining me today. I know that I'm going to be passing the program over to you. I may have a few questions, but mostly I'm going to be looking to you to have a conversation. And for sure, we want to know more about what's happening with long-term care, but also what are the partnerships in our community that are linking together to do the planning and to help to bring people to the table who will help move us through this COVID-19 pandemic, as well as with other programs. So, who would like to go first? You get to choose.
Well, I'm glad you started the show with that excerpt from that email or that letter from Francesca. She circulated that around to, I'm guessing, a lot of her colleagues and community partners. And I read it, and it did bring a little tear to my eye because there are so many people who are playing such an important role in everything that we're doing to protect individuals, communities, organizations, and then across the sector. So I took a minute to forward that to my teams in the 3 homes that I work with to be able to say, I see you too, and thank you for the work that you're doing. So I think that's a great way to start a show about a pandemic that we're a few weeks into. So there's been lots of work happen. I know people are really interested in what are some of the things that are happening in long-term care. So I can give a little bit of an update. And if you have questions, just interject and ask more. So the province and public health and the Ministry of Long-Term Care and a variety of ministries are sending out guidance documents, directives, different strategies that we should be introducing into our homes. And so those come as often as hourly, daily, weekly. And so the teams are working really hard to work through that information. But what does that mean for people who are living in long-term care or working in long-term care? We're doing vigilant screening of all people who come into the homes. So this is across all of the province. You'll notice, well, we've actually restricted all visitors. So at one point we were screening all visitors, but now we are screening residents twice a day. So we have a high surveillance of how are the residents doing. And that's pretty normal protocol, but we're also taking their temperatures twice a day to really be watching for any sign of a symptom that might need further exploration. And we're screening staff as well twice a day. So they come in and they answer questions about how are they feeling, and we take their temperatures. So that vigilant screening is that first step of making sure that we're really careful about who's coming and going from the homes. And then inside the homes, there's a lot of strategies that have been put into place, and very similar to outside in the community around that physical distancing. And I want to make sure that I don't forget, I like that we're calling it physical distancing now and not social distancing. And at some point, in case I forget, we need to talk about how do we stay socially connected when we're physically apart from each other. So people will find that they'll get updates from their homes, from the administration and the teams. I've heard of a variety of different ways that people are communicating with residents' loved ones. What they'll hear about in the homes is it'll depend on the physical layout of the home. So in a newer facility that has lots of open space, it's easier to do congregate dining, for example, where residents are more separated from each other. So we're doing strategies like moving the tables apart, farther apart, having only 2 residents at a table instead of 4. Some residents might be doing room service, so they're having all their meals in their room. Some homes are doing a combination, some are doing all meal service. So those are the kinds of things that we're doing. Activities are one-on-one, so staff are going in and interacting with residents on a one-on-one basis. I have heard of hallway bingo. You may have seen that on social media. So residents sit in their doorway and the staff run a bingo kind of up and down the hallway. So we're trying to still keep connected, but have that physical distance from each other. So those are some of the strategies.
So if you don't mind, I'll just ask a few questions. Now, so you're doing temperature even on staff as well as the residents and asking them about the symptoms they're feeling, if any. But swabs, can you just update me on the status of swabs?
Sure. So, and there's been lots in the media about swabs, and there was a shortage of swabs, although I know that there has been an influx of swabs come into our area, so we are much better equipped, and we work closely with public health to access our swabs. They bring them to us, we take them back to them for processing. So right now, what happens if any resident or staff has even one symptom, even if it's an atypical symptom, so it might be an upset stomach versus a sore throat, that makes them eligible to be swabbed. There is a planning in place for broader swabbing of all staff and all residents, but that needs to be done very systematically and in partnership with public health, or we'll overwhelm the system and we won't get the results that we need in a timely manner. So we need to do that systematically. So the first phase of swabbing everyone is for any homes that are already in an outbreak. So if there is an outbreak or residents with symptoms, then that home would have a process put into place to swab all the staff and all the residents.
Who does the swabs?
Well, and that differs. And so Stephen might be able to give an update on the community in long-term care. All long-term care homes have registered staff on their team, and the registered staff, RNs, RPNs, are trained in how to do the swabs.
Okay. Stephen, did you want to add something?
And currently, there's the 3 assessment centers. We have Owensound, Kincard, and Hanover. Might want to look up their most recent hours. I know they're all changing depending on demand, but there's the 3 assessment centers, and I do know some primary care providers are starting to try to access swabs themselves to be able to do the testing. So your best bet is also to contact your family physician, see if they are one of the family providers doing that. Yeah, right now the assessment centers are open and running and available to meet demands.
Can you describe the partnerships that you're involved with, and who is actually around, I guess, the table, but it might be a virtual table these days?
Yeah, I can start there, and because I think one of the long-standing partnerships we've had in Grey Bruce is the Grey Bruce Integrated Health Coalition. Historically, we've met once per month in person at the Grey Bruce Health Unit, and it's all the healthcare leaders from the different sectors in Grey Bruce. It's running long before I started working here in Grey Bruce. I think sometime in the 90s, maybe it started running, and it's evolved over the years, but we've actually kept that going virtually or teleconference, and we're meeting every week to discuss what's going on in each and every sector amongst Grey Bruce so that we can start planning. And amongst that, there's other various planning tables. I know Jennifer sits on quite a few. She can probably name a couple specifically to long-term care as well.
Sure, and if you don't mind, I'll just add that this is some of that invisible work that's happening, and it's happening quite literally around the clock. And so in Grey Bruce, then there's 19 long-term care homes, and we've been meeting weekly as well with public health. Yesterday we met, and we also had the 3 hospital partners join in on the call so that we can start planning and make sure that we all know what each other's needs might be and how we might be able to work together. Regionally, which is Ontario Health West, formerly the LHIN, there are several groups working, and I'm part of a Southwest Regional non-hospital planning group. So that's long-term care, retirement homes, community, and that work is important to make sure that no one's left behind, that we're looking after everyone on this journey.
Yeah. So, sorry, what you're describing is the fact that in Grey Bruce we have strong partnerships that have existed before, and you're utilizing those partnerships as we move forward. Are there new partners that have come to the table?
It's interesting you say that. As we've evolved to this, we have added new partners. Some have taken an assisting role, some have taken a front seat role. Of course, the Grey Bruce Integrated Health Coalition historically has been the service providers, but with this pandemic, public health has taken a lead role on the Integrated Health Coalition. So we have Dr. Lena Lee participating on that on the weekly calls. We've also partnered with, as you mentioned earlier, Francesca and United Way to look at a lot of the vulnerable sectors, make sure we are helping as we can through healthcare and community programs, all those sectors. So we really have the door open to everybody and anybody that we think can help. And it's, we hear a lot on the news about, all the negatives going on, but I can let you know day to day, the positives and the hard work that is happening between providers and through the staff is quite amazing. We are lucky we get to see firsthand a lot of these good news stories where people are putting aside whatever they're supposed to do and they're doing what needs to be done. So it is great to see these new partnerships form and older partnerships evolve into new places they've never been before. So it's quite exciting.
Yeah, a sort of a little bit of a silver lining to this really big dark cloud that we're operating under at this point in time. I wondered, now Jennifer, you mentioned about, I think you said 19 long-term care facilities in Grey Bruce. Now, is that a combination of private homes as well as county homes? So it doesn't matter whether it's a private sector, everyone's at the table.
That's right. Everyone's at the table. And we've also I've been invited to join the retirement home call. Public Health has been working with retirement homes, and so there's a call tomorrow, and I'm going to join that and just see if I can offer some linkages and maybe get some feedback from that group as well. So yeah, it doesn't matter, public, private, small, large. We're all journeying on this path together. So.
Because retirement homes are another place where group activities can happen, the dining as well. So that's certainly a large sector, I would assume, as well. So that's a good thing. I have a few questions more about, can you tell us how your PPE supply is? How are we situated here in Grey Bruce? And then you asked me not to let you forget about social the social thing. So I'm into the social thing.
So PPE is a really good example of what Stephen was talking about, the innovation and the collaboration and people and groups and organizations coming together in a way that we have only dreamed of being able to do. And so the PPE is a system that starts provincially and then has hubs in all of the different regions. And there's partnerships in Grey Bruce between the Grey County, but the hospital group, public health, and so that group together helps coordinate the donations that have come in. So I'd like to give a shout out to all of the small businesses and people in the community who brought in masks and gloves and gowns and hand sanitizer and all of those items that were called out for. And those are being stored at Grey Roots. And so some staff from Grey County are helping coordinate the distribution of those donated items. And then the hospital and public health have staff on that project that we can reach out to. If we're in a crisis or in urgent need of PPE, we can reach out and we will have those delivered to our organization within hours. On the call this week, everyone's doing okay for PPE. There is a shortage of reuse of disposable gowns, and so we're working on what might we do for a campaign for sewers to help make reusable, washable gowns. So stay tuned. We're seeing if we can get the details on what's needed for that. But everyone is doing okay for PPE, and it's something that we track every day. We track our inventory every day.
So, okay, but you can quickly respond to a need. Like you've already identified, you're anticipating there's going to be a need, yeah, and there's a strategy. And Stephen, is this where the partnerships that you're involved in as well? Like, for example, is there sharing of I don't mean reusing PPE, I want to make it clear, but sharing of resources with the partnership?
Yeah, I think in Grey Bruce, the close-knit partnerships we have have helped that, so that if somebody is short, they can reach out to their partners and say, Grey Bruce Health Services, we are really short. Is there any day you can supply us with one day if there's nowhere else? So, and depending how everyone's doing, as Jennifer said, we are okay. So you may have to call a few partners to find a little bit extra, but we certainly know that it's one big, area, Grey Bruce, and supporting one person supports the other person. So we want to make sure that everyone has the PPE they need, because that will affect everybody. So
the social issue, you called it staying connected, but physical distancing, but socially connecting.
Yes. So we all know how important that is, and I think as the days and the weeks go on, we recognize even more intimately ourselves how important social connection is. And it's important for our residents in long-term care. Having said that, we know that to keep this iron ring of protection around our homes, we need to have very strict rules about visiting. And so I want to acknowledge just how hard that is. I know that that's hard. It's been a long time since I saw my grandma, who lives in a care facility, face to face. So I do know how challenging that is, but I appreciate how people are following that, how important it is to keep that iron ring around the homes. So in Grey County, in the 3 homes that I work with, we have the Color It Connect program. And so we have some staff from other departments in the county who have been trained and redeployed into long-term care. And they're helping us out with screening. So they're helping with the screening, and they're also helping with the Color It Connect program, and that's scheduling Skype and FaceTime appointments with residents and their loved ones. So people can connect, they're connecting either by Skype on an iPad or FaceTime, or a lot of just the good old-fashioned telephone, but some residents need a little bit of help holding the phone up and making that connection. So that's a program that I hear is happening broadly across the province in long-term care.
What are you hearing back from families? Sorry, Stephen. Go ahead.
It's just going to go on top of that from the families. We work with a lot of husbands, wives, children of people in long-term care, and it's difficult beyond belief, right? It's 90th birthdays, 100th birthdays, missing a lot of milestones, and they're scared, and there's a lot of fear. So that social connection is important. When any way Alzheimer's Society can help or long-term care can help, we are doing everything we can for that connection. Hopefully iPads or video connections, phone calls, they're all important. We know this time can be so very stressful, and we just know how important it is to connect. The reminiscing with your partner, the discussions with them. It's so important, and we know the challenges of not seeing people that you maybe have seen every day for the last 50 years, and then all of a sudden you can't see them anymore. So connect with us, connect with your support worker, and we'll make sure that somehow you can still partner up and see your loved one in long-term care, because it's certainly very challenging these days.
Mm-hmm.
Are you having people who want to take their loved ones out of the long-term care facilities here in Grey Bruce? And if that's so, how does that work?
So in my 3 homes, there's been discussions, and so we have social workers on staff on the teams as well in all of the homes, and so they help provide some good dialogue about what does that mean. And I'll let Stephen talk about a resource tool that he has provided us that helps work through what are the different things that you need to consider before you make that decision, because it is a really big decision.
Mm-hmm.
We haven't had anybody do that, opt to move someone home, but it is an option if people are thinking about it. I encourage them to contact the home, talk to the director of care or the administrator, executive director, to just talk more about what that might look like, and then what kind of services can we help support so that they are able to manage at home.
Both the Alzheimer's Society of Grey Bruce and CanAge have developed resources that can help you guide you through that decision. You see a lot of things, and your first reaction is to bring your loved one home, support them at home, and that might be the right purpose for you, but it might not be the right cause either. So there's a lot of different variables to think about. The care needs of the person, the accessibility of your home and their accessibility needs, the supports you have. Is it still just you, or do you have other family that's able to, help? The health of the person, is transporting them home in their best health interests, the likelihood of having to transport them to hospital. So we've developed a checklist for people with dementia, but it's also relevant to people without dementia as well, to look at really all the different variables. And again, we've shared it with all of our long-term care partners so that whether you contact us or contact them, we can walk through that with you. Things like primary care physicians. Do you have one in the community, or is yours tied to the long-term care home? There's a lot of variables. So it's something that we really want to think out instead of just reacting, because every situation is certainly going to be different.
I find that really helpful to know there is that list there. You've mentioned some things that I maybe wouldn't even occur to me until you're starting to mention. What's happening with the stress levels of the caregivers, or the families whose loved ones are in nursing homes? What are we seeing out there?
We knew our care partners were resilient. There's never ever a question about that. And the strength we've seen since this pandemic has started has been breathtaking, really, to describe it. We've had so many people step up, and I don't know how they're doing it, but they're supporting their loved ones 24/7. Supports that they're used to, such as our active living program or the day away program, aren't there for them anymore. They're not able to see their children that may be far away that used to visit on weekends, but they're still. So the vast majority understand it's really hard, and they're doing really well. There is a portion out there, though, that is struggling. So that's where we always say, please check on your neighbors, check on your friends, reach out. There's a new website called The Do from United Way that can connect you with volunteers, whether it's a phone call to see how you're doing. You can call us, and even if we're not the right place, we'll redirect you to who is. So, but reach out to us, or reach out to your neighbors. It's so important, because there's some people there that they don't have any home care for whatever reason, that the PSW hasn't shown up or hasn't been able to work because they're ill. They have no family. So this is the time, and 90%, I'd say, the community has come together really well, but there's still a few just falling between the cracks. So want to make sure, you may feel like you're bothering your neighbor, but you're not. Just a friendly phone call, drop off a basket, make sure everyone's, okay. We're truly in this together, so we need to make sure that we can continue to support each other.
I've heard of curbside delivery, but even veranda or front porch drop-off is a good strategy to use. We have a minute left in the program, and I'm wondering, how are you both doing, and are there any last comments you'd like to make in the minute?
So, well, I'm doing great. I have a great team that I work with, and the partnerships that Stephen and I have talked about help keep us going, and emails like Francesca's. And I have been ending my calls with the families when I do a virtual call by expressing my gratitude for the residents for being understanding, supportive, and staying positive, the families and friends for their kind words of encouragement and staying away when I know it's hard to do, and to the team members in the home for their courage and their commitment. And I just wanted to reiterate that.
Perfect. And Stephen?
I'll wrap it up with how you started. The thank you and the good news to the essential workers, all the work that's being done. You can't name all the great things. My volunteer board of directors that said, go out and do whatever you need to do, and we'll get it sorted after. There's volunteers everywhere that are helping, and just the good news stories are outweighing the negative. So
thank you. That is wonderful. I want to thank you both for being on the program and sharing this information. And I want to thank our viewing audience for joining us today. Please take care of each other, and stay safe. Thank you.